Hey, this is Lisa with Fitness for Paws Health Promotions, providing wellness solutions for man's best friends. Today is an episode of our anatomy shorts, and we're going to be talking about the canine hip. You've probably heard of hip dysplasia, but I don't know if you know what it is. So we're going to look at this model, and we're going to turn this dog around here, and we're going to see where this hip joint is. So the hip joint is a ball and socket joint. So the ball of the femur, which is the upper leg bone, hits here and goes into the socket, which is called the acetabulum. And as you see, it's got a good fit there. It's a synovial joint, which means there's fluid in there to decrease friction between the articular surfaces, so the hip can mostly flex and extend, and very little rotation. So the flexors would be the iliopsoas, which would be one on the front of the hip, and then the hamstrings and the glutes, which would be on the back. And you would have strong ligament connections here between the hip into the joint. So what is hip dysplasia? Turn this guy around, and this is kind of not so nice looking hip. So hip dysplasia is more common in your large breed dogs, such as your Great Danes and St. Bernards. And basically, it is when there is incongruous development between the head of the femur and this acetabulum, this joint in here. So the growth is not at the same speed. Large breed dogs may grow too fast, so we really have to watch how much food we're feeding them and talk to your vet about the appropriate nutrition. But if the growth is too fast in these dogs, you're going to get some problems where you can see that this femur does not fit well within this acetabulum. It's not a good fit there, and it can cause these degenerative changes in both surfaces. So, hip dysplasia. Signs might be lameness, unwillingness to walk or run. So in your puppy, you get those Great Dane puppies, German Shepherd puppies, St. Bernards. Make sure you talk to the vet in terms of how much to feed them so you don't overfeed them. Any signs of lameness or unwillingness to jump or run or walk, bring to your vet's attention, and they can make sure that they rule out any type of hip dysplasia. But again, this femur, the head of the femur does not make a good contact in this ball and socket joint. There's too much laxity in the joint. All right, that's our version of Anatomy Shorts. Hope you enjoyed it.